My final guest is Senator Bill Cassidy of Louisiana. He serves on the Health, Education, Labor, and Pensions Committee, and he's the ranking member of its subcommittee on children and families. I spoke with Senator Cassidy just a short while ago. Take a listen.
Senator Cassidy, thank you so much for joining us. Look, our job today in these discussions we've had is about envisioning a different healthcare world, a different way that people get health. And you know, I sort of feel like there's this tension between little incremental steps and big strategic leaps. And I know that you've been involved in so many different efforts on obesity, on maternal mortality, on telehealth. Can you tell us what you think are the most important opportunities we have to transform healthcare in this country?
I think I'll go in two different directions. The first is, how do we bring technology to the person where she lives as opposed to requiring her to show up? Our Connected Moms recognizes there is a disparity in death after pregnancy.
And so Connected Moms is a program, right? Connected Moms is a program? Okay.
Name of a bill we've offered. It would allow her to stay at home. And there's racial disparity associated with this, socioeconomic disparity. It would allow her to stay at home, for example, and get her blood pressure monitored, and this to be transmitted electronically. Really very simple. But it would make a big difference for someone who's in her 9th month of pregnancy taking public transportation to get her blood pressure monitored, maybe in where I live in Louisiana, August. What a difference that would make. So why don't we bring all this technology we have to where she lives, as opposed to expecting her to come and kind of participate when she comes? I can give different examples. Everybody's familiar with the impact of telehealth and telemental health. And so again, we should, making sure that it's not abused, nonetheless make that available. That's number one. The second is to begin to do something serious about obesity. Obesity drives an incredible amount of the healthcare costs in our nation. Whether it is the heart disease, the joint replacements, the strokes, the cirrhosis leading to liver transplant, gallstones, I could go down a list. And yet it's been something that has continued. It has continued to be, how do you put this? The incidence of obesity over the last 3 decades has climbed dramatically, but we've not really been able to address it equally dramatically. And so we have the Treat and Reduce Obesity Act, which would allow Medicare to begin covering pharmacologic therapy for obesity. We think this could have a huge impact in addressing morbidity, mortality, and cost of care.
You know, I know, thank you for those. And I completely agree that, you know, one of the things in obesity care that we often don't think about is it also tracks with some of the socioeconomic differences and divides in society. We have a lot of challenge, and the comorbidities. When you look at the death rate from COVID, that often was, you know, laying over. You don't need me to tell you this, but I do want to raise the issue of how we improve access in the healthcare system. You worked in the sort of charity health system in Louisiana for 25 years. What are your insights there? What should we as a nation be doing that you were doing down in Louisiana that we should learn from?
I do think telehealth is a major advance. So when I worked, I did a lot of work caring for patients in prison. Now, to go to a prison, at least in my state, you may have to drive an hour or an hour and a half away from where your practice normally is, an hour and a half back. That really is kind of a law opportunity cost associated with that. If you had the specialist who was in a more distant city, quite often that specialist couldn't arrive at all. So we began to implement telehealth 15, 20 years ago, made a big difference with the dermatologist looking at the rash, the nurse right there to interpret a finding, to report a physical exam. Yes, it's a little bit bumpy. It's not entirely flat. Yes, I'll look here for you, to move the camera around. And it brought specialty care to a setting which ordinarily would not be the case. That is what the COVID pandemic has precipitated in society writ large. The degree that we can do telehealth or telemental health could really move access to specialized care dramatically higher. And that will be a silver lining of the pandemic.
You know, another dimension of the healthcare system, which you just mentioned, is pharmaceuticals and you know, different innovations that are out there to begin addressing both chronic problems, but other ailments. And one of the areas there's been a lot of divides between, say, Europe and the United States is in areas like biosimilars or complex generics, or a whole range of new drugs that could come online. And I'm just wondering, from your position in the Senate, you know so many doctors, there's so many doctors abounding in the House and Senate now. But I mean, what is your sense of competition in America? Is it where it should be by way of getting us into the next arena of drugs? My sense is there's a sluggishness. I don't know if I'm right, but I would love to get your perspective.
Sluggishness is the perfect word. And the reason it's sluggish is multifactorial. And speaking now specifically regarding biosimilars versus originator drugs, the originator companies have been able to prolong the exclusivity of their product being used long past the patent expiration. They've done this through arbitraging various laws as well as kind of manipulating market dynamics. And because of that, we continue to pay far more for biologics than we should. If you look at, oh, wait a second, it's been off patent for 10 years, but we're still paying this much. So that's going to take it's going to take legislation. And that I think is very troubling. We want to pay for innovation, but we don't want to reward people who are not being innovative. Rather, they're merely arbitraging laws set up to protect innovation. And that's what's most troublesome. Again, the very law to promote innovation is being arbitraged, not for innovation, but to actually keep innovators out of the market. That's what concerns me right now.
I want to ask you a big question. I mean, I tell people I want to ask a meta question, but now I can't do that given, Facebook's new title company. But, a big question about the overall health profile of America. When you see what COVID has done and the impact that COVID has had there, I know you've been working a lot on mental health. I've talked to Senator Blunt, Senator Stabenow, others that have been highlighting this as well as yourself. I'm just wondering, do we have a holistic way to include mental health and part of whole health, if you will, as opposed to pushing it off to the side and looking at it as this other thing that needs to be treated sort of like an orphan on the side? I don't know if I'm expressing it right, but I know that you have real strong thoughts that mental health is as much a part of our health as our liver.
Yeah, I'll first take off on that, then answer your question in somewhat maybe divided way. Everybody watching this has someone either in their family or in a close circle of folks they knew or once knew with serious mental illness. I do, or did. And we all do. Now, it becomes something that people almost don't discuss. One, you just maybe don't feel a need to. Another, there's almost a little bit of an embarrassment at times for people to bring it up. So I do think, one, we have to acknowledge how widespread serious mental illness is. If you add addiction, there may be whoever's out there saying, well, I don't really have anybody who's seriously mentally ill. I know. You add addiction, they absolutely know. One example just comes to mind, and I'll say it because it's so telling. A very beautiful woman I went to high school with. I just remember she was so pretty. But she walked down the hallway, always facing the wall, kind of knocking her fingers against the wall, had no friends. So she was the kind of person that you would expect boys to be asking her out every Friday night. She had no friends. Well, I saw her later as a patient, 30 years later, and she was seriously mentally ill, but someone knew it, but no one intervened. So I use that to say that we actually now have some programs that will go to that adolescent or that young adult and wrap her around with all the services she needs after her first episode. Hopefully that her first episode is her last episode. And in a scientific method, these have been evaluated and they work. That's a good thing. Now, there's another set of the issue that we have not holistically enough. We cannot but notice that economic dislocation has led to a higher rate of addiction and other things that then become a co-diagnosis with serious mental illness. So now that may be beyond the scope of healthcare. Now you're beginning to speak about society. How do we address these issues that are more broad?
That's a powerful framing there, and I really appreciate it because I also think we need to talk about these issues, and I just hate this stigma that hangs around, whether it's obesity, whether it's mental health. You're not going to solve those problems. But I guess lastly, Senator, and hate to put this responsibility on you. I know you try to work across the aisle all the time, and I hate asking partisan questions. But if you were to kind of look either at the blind spots the last administration had, or the blind spots this administration under President Biden has on how to approach healthcare and to achieve greater overall health in the country? What do you think the biggest levers are that we ought to play? I know telehealth and paying for that, getting in the way is one, but what are some of the other dimensions that we can think in big ways that either Republican administration or a Democrat administration ought to have on its dashboard that you feel it has not been there adequately?
I'm going to give credit to both administrations. One, we have to make healthcare affordable, because otherwise, eventually, it won't be affordable for society or for the individual. And the last administration made the first initial attempts to inject price transparency. I think price transparency has the ability to revolutionize affordability. So they actually made the initial attempts. And this administration has attempted to strengthen some of those rules. We've got a long way to go. But the fact that we're actually making progress is notable, hopeful, and hopefully we can build upon in a bipartisan way.
Well, thank you. Well, finally, I'm going to ask you a question I asked one of your House colleagues, a Republican member, Michael Burgess of Texas, who's also a doctor. And I said, Michael, do you prefer to go by doctor and be known as a doctor, which he is, or do you prefer to remember, representative? And he says, well, let me tell you, doctor polls much better than House of Representatives member. Let me ask you about gastroenterologist or Dr. Cassidy versus Senator Cassidy, which plays better in Louisiana?
Well, usually I go by Bill, but because one, I'm not on a pedestal. But secondly, being a physician is an incredible privilege. And taking care of the patients whom I took care of, we still see each other and we still communicate. And it's just a connection that can never be broken. It's an honor to be a senator, but I prefer being called doctor if somebody wishes to use the title.
Well, I love your Twitter handle. It says gastroenterologist, if I'm saying it correctly, who happens to be serving in the Senate right now. So Senator Bill Cassidy, gastroenterologist, Dr. Bill Cassidy, thank you so much for joining us today.
Thank you, Steve. Appreciate it.
That brings us to the end of our program today. A very big thank you to Beatrice for its support of these great conversations. They were really great. And all of you attendees for joining us. For any of you who missed this program today, we're going to have this entire video up on our website shortly. It's great to check out, watch again, share with your friends. I'm Steve Clemons. Be well.